cooperative with their language statement. So I'm going to turn it over to them. Oh, okay, let me get, she is in the Spanish channel. So Misty, if you can help Gisela get back from the Spanish channel, maybe pause it again.
Let's see, I didn't start it, but let me. All right.
Okay, did that work?
Yes.
Perfect.
Hello, everyone. My name is Gisela Escobedo, and I'm here with the Community Language Co-op, and we're here to help create a space for language justice. What that means is that we want to create a space where everyone can participate and engage in the language of their heart or the language that they feel most comfortable in. I will use simultaneous interpretation to create this space. When I finish saying this in Spanish, we will turn on interpretation and you will see a globe icon that says interpretation. If you're not fully bilingual, I ask you that you select your preferred language. If you're bilingual, feel free to listen to everyone in their language. When you select your language, you can check mute original audio so you don't hear both languages at the same time. Hola, mi nombre es Gisela Escobedo y estoy aquí con la Community Language Co-op y estoy aquí para ayudar a crear un espacio donde todos practicamos la justicia del lenguaje. Lo que esto significa es que queremos crear un espacio donde todos puedan participar e involucrarse en el idioma de su corazón o en el idioma en el que se sientan más cómodos. Voy a usar la interpretación simultánea para crear este espacio. Cuando termine de decir esto, vamos a activar interpretación y verá un icono de globo que dice interpretación. Le da un clic ahí y escoges tu idioma. Si no eres completamente bilingüe, pedimos que selecciones el idioma preferido. Puedes silenciar el audio para no escuchar ambos idiomas al mismo tiempo. Muchas gracias. Thank you very much. You can go ahead and turn on interpretation.
Great, thank you very much and welcome everyone. I'm going to turn it over to Nicole Steffens from Metro Denver Partnership for Health and the Colorado Health Institute for announcements before we get started.
Thanks, Helen, and welcome everyone to our second training with our Community Ambassador Program under the Metro Denver Partnership for Health, MDPH, if you have seen our acronym. I'm the program manager for MDPH as a whole, which is a collaborative of all the health systems and the local public health agencies and human service agencies in the Denver metro region, which is our 7-county metro region. I can get you that list, and also in the chat, I'll put our website so you can just take a look there. For those of you who are new to the Community Ambassador Program. So MDPH is helping host this, but all of your local public health agencies have been your key contacts, helping move this forward. And we are so grateful to have all of the ambassadors here at the table. We are grateful for that local public health agencies for helping be experts throughout this process and leading this training. So thank you to Denver Public Health for putting this together for all of us so we can learn more about the COVID vaccine and how to communicate this with our audiences and with our communities. There's a lot of work to do here. We all know that, and a lot of stuff in the media. So we're grateful for all the work that you have done and for your partnership here. And if you have any questions about Colorado Health Institute, who's the backbone of MDPH or MDPH as a whole, I will also put my email in the chat, and you're welcome to follow up with me offline as well, otherwise through your local public health contacts. So welcome everyone. We are super excited to have you here. If you want to learn more about the flu shot, we have a different training that's online, and we'll make sure to get that to you afterwards as well. Thanks, Helen.
Great, thank you, Nicole. And I just want to let you know that myself or Denver PTC, we are available to help troubleshoot any technical difficulties that you have during today's presentation. So feel free to private chat us any questions you have. And then Michelle and I definitely don't mind being interrupted or capture those questions in chat, and we'll make sure that we address them. Our goal is to have plenty of space to have dialogue with you all and questions. So we do have some question times planned in our presentation, but if you have something you want to discuss, feel free to come off mute or put it in chat. So with that, I'm going to pull up the slides and I'll turn it over to my colleague, Dr. Michelle Haas, who's going to walk us through content on what we know about vaccine.
Thanks, Helen. And just to give you guys some background, I think some of you may, I think we've worked together in the past. So I'm Dr. Michelle Haas. I'm an infectious disease physician here at Denver Public Health, and I've been involved in our COVID response. Prior to COVID, my specific area of expertise was in tuberculosis and HIV. I'm the medical director of the COVID-19 Enhanced Patient Support Program. And our program aims to connect uninsured patients with free medical care in Denver County. We also partner with a number of community-based organizations to uplift health information in the community and connect community members with food and financial resources. And with our community partners, we've been talking about the vaccine for quite some time. And I recognize that some of this background may be review, but we'll kind of start kind of in the middle, and then hopefully we'll have lots of times for specific questions from all of you guys about the different vaccines. Go ahead, Helen, next slide. And so hopefully by the end of this training, you'll feel empowered to discuss the safety and effectiveness of the COVID-19 vaccines. We'll go through reasons for vaccine hesitancy, and so Helen's going to talk a lot about that, and summarize 2 communication techniques that could be used to address vaccine hesitancy. So I thought I would start just with some of the perspectives from community members that I think a lot of you guys may have heard. So one community member who was at a vaccine event, and these are slides obviously taken from the Colorado Vaccine Equity Task Force, and I am also a late member of the task force. I joined in January. So Richard Casillas, who said he actually would feel safer if more folks got vaccinated, and he expressed that he'd experienced a lot of loss in his circle of friends related to COVID. And then Janie Leddes Mason, who also felt fortunate to be able to get the vaccine. And, I have to say in some of our conversations with our community partners, we are hearing a lot of folks are interested in the vaccine and have had trouble accessing that. And so we'll talk a little bit about that if there's some time in terms of how you can help folks navigate or how to gain access to a vaccine as well. Next slide. So I think everybody is quite familiar with the devastating impact of COVID-19. These are just the most recent demographic data on deaths here in Denver County. And I know other counties have suffered similar losses where we clearly see a disproportionate impact on communities of color. In this graph, I actually filtered out deaths that were experienced by folks who were living in congregate settings. So I think this is more reflective of what the community has felt and experienced. And so you can clearly see the disproportionate impact, particularly among our community members who identify as Hispanic or Latinx, where 43% of deaths in Denver County were among folks who identified as Hispanic or Latinx versus 29% to the population. Among folks who identified as Black, 11.1% of people who died from COVID identified as Black versus 8.5% of the population. And so obviously a tremendous loss that we've all felt. Next slide. And so I also think this is largely review for a lot of folks who are on the call. So I think it's pretty self-evident that COVID has disproportionately hurt our communities related to issues surrounding racism and structural racism in particular. I think we all know that race is a social construct. There's no genetic or biologic disposition or predisposition. And that systemic racism in particular has created these inequities, which have been magnified and perpetuated by COVID. And the system is clearly functioning as it was intended. The system of structural racism and racism is meant to harm communities of color, and we are seeing that. And you can see this graphically represented. You can see it and you hear it in the stories from our patients. This graph is put together by one of my colleagues, Christy Mettenbrink here at Denver Public Health. And what she has done is she overlaid a map of redlining with a map of testing positivity. She put this map together back in November. And what you can see, and I recognize that the colors are actually a little bit hard to tease out, but so the red lines are areas of redlining that were marked as hazardous. And the darker gray bars were marked as declining. And you can see striking overlap even out here along Colfax between areas of redlining and areas of our community that have been most impacted by COVID-19. Next slide, please. So we're still seeing this play out in the vaccine rollout. And so currently only 15% of the vaccine allocations across the state are for equity. We're also seeing issues around language justice. So in terms of the call-in options here in Denver County for people to call in to get on a waiting list, there's only one option in Denver County that gives information directly in Spanish. Almost all the other phone trees are in English, and no other languages are represented. None of the handouts so far coach patients on what to do to get the language that they need. And so what we do in our outreach to the community in terms of how to coach patients to access the vaccine is really important, particularly around issues of language. There's only one waiting list that I've been able to find that's available in other languages through this internet-only sign up. And so this graph here is where we are based on vaccine access for race and ethnicity here in Denver County. And we've also, what this graph also shows is it pairs not only percent of initial first dose vaccinations, but also measures of COVID burden or the impact of COVID within a particular community. And so just to kind of walk you through, so if we look, for example, at folks who identify as Hispanic or Latino, what we see is that 9.1% of vaccinations in Denver County have gone to someone who identifies as Hispanic or Latino, versus 49% of people who are diagnosed with COVID identify as Hispanic or Latino. And so, when we're talking about equity, and also accountability and metrics, what I would submit to you is that what we need to be aiming for is measures of COVID burden. So it's not, in my opinion, it's not just enough that we make sure that 29% of people who are vaccinated identify as Hispanic, but we make sure that our outreach matches the COVID burden experienced by specific members of our community. Next slide, please. So in terms of how to also prioritize vaccines in the rollout, so this is an analysis that was also done by Christy Mettenbrink here at Denver Public Health, where she and her team carefully analyzed looking at percent positivity by neighborhood in Denver County, also looked at hospitalizations and deaths, and then also looked at vaccine rates. And so with that analysis, she was able to identify sections of Denver County that have limited access to the vaccine, and so we can prioritize our response across the city. And so what she's found here, and again, and this is not terribly surprising for those of us who work in Denver County, is that areas of Montbello, so 80239 zip code up in the Northeast corridor, and then different aspects of West Denver, this is 5 Points, are all areas that have very limited access to the vaccine, but have experienced very high burden of COVID. And so those are the areas that our city is currently prioritizing for fixed community vaccination sites, as well as community organized events as well. Next slide. So with that background in mind, I wanted to turn to briefly talk about safety and COVID-19 vaccines and their processes by which they were evaluated. So I hear occasionally from patients, wondering about, well, is natural immunity better, or maybe it's better for me to just go ahead and get COVID and get it over with. So I hear sometimes that sentiment as well. And certainly natural immunity can be powerful, but it's incredibly risky for someone to acquire immunity to COVID through actually getting COVID themselves. And so it's risky, not only because it risks hospitalization and death, particularly for folks who have complications, but there certainly are patients, and I have friends also who can have persistent symptoms of COVID. So they got COVID and they recovered. One of my friends had COVID back in March, and this person is still not able to exercise the way that they used to. I have another colleague of mine who lost their sense of smell, and that was last year, and their sense of smell hasn't come back. And so I think, that's also an important thing to point out to folks is that, as a younger person, or someone without risk, you may not, your risk of being hospitalized or dying from COVID may be low, but there's also there can be a tremendous impact on a person's life, where you may not be able to have the same level of activity that you did before, even though you've recovered. And if you're vaccinated and you acquire immunity that way, you don't have any of that risk. You won't experience any of that risk from getting infected with COVID. And so vaccination is a far safer way for us to build protection against COVID-19. And I think, at this point we have, a little bit better sense about how long that immunity might last, at least in the sense that we've been able to study patients who got their first doses of the Moderna and Pfizer vaccines back in March of 2020. There's still some uncertainty about that, but I think that the general consensus is that the immunity that is generated from the COVID vaccine is likely to last longer than as much as we know about natural immunity. And so again, it's a safer way for us to protect ourselves. And it's very likely that it may afford us a little bit more protection and longer lasting protection, all variants aside, of course, than natural immunity itself. Next slide, please. And so how do the vaccines work? I did amend this slide from the Colorado Vaccine Equity Task Force because now we need to talk about the Johnson & Johnson vaccine. So it's not, it's a little bit of a different construct. But they're all three vaccines have material that generates immunity to the spike protein. And so the spike protein is actually how the virus gets into our cells. And so with the Pfizer and the Moderna vaccine, it's a messenger RNA construct that tells the cells to make the specific part of the virus. For the Johnson & Johnson vaccine, it's actually double-stranded DNA. And that double-stranded DNA does enter the nucleus, but it cannot integrate. It's not set up that way. So it's just a slightly different construct, but it generates the same, it tells our cells to make the same protein, so make the spike protein. And then once our cells make the spike protein, that's what generates this immune response so that our bodies can learn to respond to the spike protein and then protect us in the future if we were ever to encounter COVID. Next slide, please. So safety of the COVID-19 has been a top priority, and we'll go through a little bit more in terms of the number of people that were studied in the clinical trials. Just to know that both the FDA and ACIP, they will do independent reviews. They're independent of the clinical trialists, and the FDA alone will actually get individual patient data. So they'll get they'll get a summary report, but then they actually request the individual patient data to go through for all of the trials before they will grant an approval. Next slide, please. And so in terms of the clinical trial participants by race and ethnicity, and I've gotten this question a lot, a lot of folks, they do want to make sure that that they see themselves in who was evaluated in the trials. And so I've lined them up here for everyone to see and review. And we'll just kind of quickly walk through each of these. So for Pfizer, Moderna, Janssen here, the Johnson & Johnson vaccine, you can see the total numbers of people who were enrolled. So very, very large clinical trials, 43,000 in Pfizer, just over 43,000, total of just over 30,000 participants for Moderna, and then almost 40,000 participants in the Johnson & Johnson trial. And what you can see here, and we'll talk a little bit more in the next slide about where the trials were actually done, is that It is fairly representative, at least of our community here in Denver, in the sense that across the trials, at least almost 10% of folks, at least for Pfizer and Moderna, identified as Black or African American, and in Janssen, that was 19%. Among folks who identified as Native American or Indigenous, you can see among folks who were in Pfizer was 0.6%, 0.8% for Moderna, and 9.5% for Janssen. For folks who identified as Hispanic, you can see 28% Pfizer, 20% Moderna, and 45% in Janssen. And then, fairly matched. So among folks who identified as Asian, just over 4%, almost 5% Moderna, and 3.4% for Janssen, and so on. And so, as you can kind of see, a fairly broad representation reflected in the trials, and how that matches up with at least folks in Denver County and Colorado. So among folks who identify as Black or African Americans, 8.5% of the population. In Denver County, for folks who identify as Native American, it's 0.4%. For folks who identify as Hispanic, it's 29%. For folks who identify as Asian, it's about 3%. For Native Hawaiian or Pacific Islanders, it's around 0.2%. And then actually for Denver County, for folks who identify as more than one race or ethnicity, it's actually about 2.5%. And then folks who identify as whites, about 60-70% of the Denver population. Next slide, please. So in terms of the lineup of the vaccine, so I'm just going to name that, I personally, it is a little difficult. It's actually incredibly difficult to truly compare the three vaccines. And I'll talk a little bit about why. And I think this is actually a really key point for all of us to kind of get on the same page about for these different vaccines. And I'm going to be really honest, like when I first heard about the Johnson & Johnson, and was hearing early reports of it, being 66% effective, my immediate thought was, well, I'm not sure that I want, my patients to get that vaccine. It seems like it's a substandard vaccine. But then I actually, read the FDA report, so I personally went through the, it's 118 pages of the FDA report for the Johnson & Johnson vaccine, because I wanted to get clear in my head, how I thought about it and what the data show. And, so I summarized that here for you guys to take a look at. And, the short sort of summary is that they're very different trials. They had different endpoints. And so I can't actually truly compare their primary endpoints across the trials because they were measuring different things. The Johnson & Johnson trial started recruiting in September of 2020 and started recruiting in the middle of a surge when we already knew that there were variants circulating globally. And it was a global trial, and they recruited heavily from South Africa and Central and South America. And that's in contrast to Pfizer and Moderna. So Pfizer and Moderna started enrolling in March of 2020. Moderna was only in the United States, and Pfizer was a bit more global. The vaccine constructs are a bit different, as we've kind of talked about. So those are some differences too. And then when you get to actually what was measured in the trial, so for Pfizer and Moderna, what they measured was, so their primary endpoint was COVID incidence, or anyone getting COVID. And then the secondary endpoints that they looked at were severe COVID, whereas in the Johnson & Johnson trial, it was kind of the opposite in the sense that they were really more interested in wanting to measure first how effective their vaccine was against folks having moderate to severe or critical COVID. And then their secondary endpoint was looking at anyone who got COVID. They also looked at different periods of time after the first dose. So for the Johnson & Johnson trial, they looked at day 14 after the first dose, and then day 28. And then they had a secondary endpoint where they looked at 42 days after that first dose. For Pfizer and Moderna, they did have some early endpoints after the first dose. So, days or 7 days and greater after the first dose, but most of their endpoints were measuring at 42 days after the first dose. So when you hear that 95% effective in preventing COVID-19 for both Pfizer and Moderna, that was 42 days after the first dose, and at least 2 weeks after that second dose. And so the differences are in what they were originally measuring as what they were looking at in terms of the impact of the vaccine itself, and then also the timing. And so Johnson & Johnson was measuring the impact of their vaccine much earlier than Pfizer and Moderna. And so the way I tried to make sense of this was looking at the endpoints at 42 days and then trying to line them up that way to try to get a sense of how they might compare to one another. And then also specifically looking at prevention of severe COVID. And so when you do that, what you see is that for Pfizer, looking at prevention of severe COVID-19 at 28 days, it was 75%. But that actually wasn't statistically significant. When you look at Moderna, prevention of severe COVID at 42 days, which is what they measured, was 100%, so it's excellent. And then for the Johnson & Johnson, when you look at 42 days out after that first dose, it was 92.4%. And so when you look at those endpoints, they actually seem far more comparable than when you're looking at what they measured. And so, you know, what you're going to see in the media and what we're going to talk about is what the trial was set up to measure in terms of their primary endpoint. And so that's why you're going to hear 95% effective. And then for Johnson & Johnson, 74% effective in the US, because they had a specific subpoint in the US. But I think the framing is important because they're measuring different things. And then also with the Johnson & Johnson vaccine, they were enrolling at a different time period. We know we have much better information about how the Johnson & Johnson vaccine will protect us against variants. We have very limited information about protection of variants with Pfizer and Moderna. And so that's another strength of the Johnson & Johnson vaccine. And there's more robust data also from the Johnson & Johnson vaccine about how it might protect us from passing COVID to another person. So there's more information about asymptomatic infections in the Johnson & Johnson vaccine trial that they incorporated in, which we actually don't have as much of for the Pfizer and the Moderna trial. So I might stop there, actually. I don't know if there's anything in the chat to see if anyone has any questions about that, and then we can kind of move on.
I have a quick question. This is Fernando. I think what I'm gathering is that I think our message should be that all the vaccines, at least these three that they are right now available, they are safe to use and they provide a level of protection. And I think very few people really want like, no, I'm going to wait for the Moderna versus the Pfizer. And I think we should, if I'm hearing you correctly, said that, you know, any kind of the vaccines available today is better than not having anything at all. In addition to that, I would love to, at a later date, to continue to hear more about, for example, Sputnik 5, which is very, Mexico did a buy. So a lot of the information that I'm getting from people from Mexico who talk to a lot of people from Mexico here is that anything from, oh my God, it comes from Russia, and they haven't disbursed all the data as all the other ones. There's a high level of resistance that of course it leaks and impacts very dramatically how family members here in the States feel and learn about the vaccine once the information is coming that that's not the good one, I should wait for the right one.
Mm-hmm. Yeah, thank you for that. That's a great point. And I think I hadn't actually done a lot of research on Sputnik. And so I think that's a really good point just to get some other information out there. So I'll bring that back to this group, or we can maybe circulate that in an email afterwards. So thank you for that.
Do you think in response to any questions about the Johnson & Johnson vaccine that you should potentially say something that it may have more effectiveness against the variants, or is it really better to not do any kind of comparative like analysis, you know, against one versus the other?
I do think it's good to call that out because they specifically evaluated that. Now, you know, the other information in the trial. So when they were enrolling in this specifically United States sites, there weren't actually many variants among the U.S. participants. So, almost none. And they actually didn't see any UK variants in the trial, which is, of the variants that are circulating in the US, that's what we're seeing. But I do think, we are going to see more variants. And I do think it's important to point that out to folks, that we know, at least right now, I mean, they're catching up, like Pfizer and Moderna are catching up, looking at variants. But we have more information about variants with the Johnson & Johnson trial. And I think the transmission piece too is important. I think they have more robust data at this point about potentially reducing transmission. It's one shot, and honestly, like when I dove into this data, I got the Pfizer vaccine, and after I saw that perhaps Pfizer, I mean it almost suggests they didn't have as much protection against severe disease. I was like, gosh, I kind of wish I'd had the chance to get the Johnson, but past is the past. But the point is, like, they're all very good vaccines. And Fernanda, to your point, like, people shouldn't wait. I do think it's important for people to have some choice and agency, and at the same time to tell, to let folks know that all of them are very good and they're all very safe. That if you have the opportunity to get one of the vaccines, to go ahead and take it. Other.
This is John Young from the Center for African American Health. I don't know, I might have to talk to somebody offline, but one of our churches got the vaccine on January 8th, and 10 of the people did not get the second one. And I don't know if that's because they didn't show up or they forgot or whatever. So we're trying to scramble to figure out what we can do so that first vaccine shot doesn't become them needing to do the whole thing over again.
Let's I'll put my email in the chat. Let's talk about, because I want to give some thought to that. I don't think they'd have to repeat it, but I want to just think about that a little bit more. So let me just put my email in the chat so we can talk more about that.
Yeah, they got the first, and I'm sitting here thinking, well, there was at least 100 people. Why didn't they say no one came back to do the second one? But I'm thinking these 10 people just didn't come back.
Yeah, so Judy just also commented. So I didn't think they would need to repeat it either. You just go ahead and get them their second dose as soon as we can. But it sounds like they need to be expedited, and so that's something that actually my team could help with. And so that might be something that we could connect on to see how we can get them vaccinated as soon as possible.
I mean, even if it's not true, they feel there's a sense of urgency, and it will help the community if it happens.
Yeah. My team can actually directly schedule folks for the vaccine. I mean, we're a pretty small operation, and we just gained access to that. So, and maybe we can talk, I can get their names and we can get them scheduled.
Okay, thank you.
Sure. I guess let's go ahead and move on to the next slide, Helen. So this one is, how does COVID compare to other vaccines in terms of their effectiveness? And so I went ahead and put the primary clinical trial endpoints for comparison. So you can see the Johnson & Johnson, 74% effective in the United States cohorts. That's the number that I listed, compared to Moderna and Pfizer, which we've talked about. And then a whole host of other vaccines. So, every year flu is probably like around 50%. I mean, some years it's better than others, just for comparison. But as we all know, we still get, a fair amount of benefit, tremendous amount of benefit from being vaccinated against flu. And then many other vaccines that I've listed here. So mumps is the other one that may not have as much efficacy, especially as immunity wanes over time, but pretty high effectiveness with other vaccines as well by comparison. Okay, next slide, please. So some other key facts, just to kind of summarize So, getting vaccinated, we've talked about, can help prevent folks from getting sick. We do believe that people who've already had COVID will still benefit from getting vaccinated. The vaccines won't give you COVID-19. The vaccines will also not cause folks to test positive on the viral PCR tests. The antibodies is a different story, but it's not really used, to test for acute infection. So, but the PCR test that we use, you won't test positive after you've had the vaccine. And then it looks like there's a question in the chat. So the question's in Spanish. I don't know if Helen, if we could, engage our interpreter, or I don't know if just so we can make sure that her question's heard.
Yes, I will message her right now.
Okay. So we just got it. Thank you so much. So someone misses their second dose. How long can it take to get it in? Or do they have to do the first dose again? So if you miss your second dose, so we want to get we want you to get you in as soon as possible in order to get that second dose. And honestly, I need to go back and look and see, and Judy, I know you're on, if there have been specific recommendations for how long between the first and second dose. My understanding is that we just get them their second dose as soon as we can.
Yeah, this is Judy. So sort of the idea is they've even stretched it to 6 weeks or 42 days.
Mm-hmm.
But if somebody were 3 months out and then they get the second dose, they can still get the second dose and they don't have to start over. And so it's not an emergency. It's just as soon as possible. Because they're not fully protected with the second until 2 weeks after the second dose.
Right. And then the question about convalescent plasma. So I just want to verify that timing. I don't think having convalescent plasma can affect when you get the vaccine, but the monoclonal antibodies can. So what I'd like to do, if that's okay, is get back to this group just to make sure that I answer that question accurately.
This is Fernando. I really like that the first message is something that I think we need to continue to bring back into the community as people get vaccinated. Because I think what I'm hearing is people saying like, I got the vaccine, I'm free to roam around in the world. And I think it's so important that we continue to master the lingo, that it's not that you're not going to get it, but it's like, as you're saying it there, like you're not going to get sick, but you can still get people sick if you are in contact with the virus. And I think that's kind of like a hard concept to get, because people say like, well, I got the vaccine, so I'm not gonna get it. It's like, yeah, you are gonna get it. You're just not gonna get sick. And I think it's important that we continue to hone in that message that still allows people to say we're not out of the woods yet, and we need to continue to do all the other things that we've been doing. But I'm hearing it a lot from people that feel like, whew, freedom, and we're not there yet.
Yeah, I think that's a great point. And I think the other challenge with that is that might change, as we get information about transmission, and that's starting to come in. But yeah, this comes up a lot for me too. It's saying, trying to sort of break it down where, I might inhale COVID if I'm vaccinated. And if I exhale it out and I go hug my mom who's not yet vaccinated, I might accidentally get her sick. And so that's why I still have to wear a mask when I'm around my mom, so that I don't accidentally pass COVID to her because I'm protected. So I think that's a great point. Let's see. So this is a question I get a lot. So how long is the effectiveness of the vaccine? Must it be put in every year? And we don't know yet, is the answer. I think, so the reason we don't know is partly because we're just now sort of rounding out a year's worth of data from those initial enrollees in the Pfizer and the Moderna trial. And then also, we know that there are variants circulating, sort of low-level circulation in the United States that impact the effectiveness of the vaccine. So the South African variant one, and then the Brazilian variant as well, are concerning for affecting the effectiveness of the vaccines. And so that's why I think there's some uncertainty around that. So we think it's longer than 90 days for sure, which is how it's sort of the general estimate for natural immunity. But in terms of like, if we're going to have to get our COVID vaccine every year, I think we don't know yet. In my personal opinion, I think that's likely, but again, I don't think we know that for sure yet. Okay, go ahead and go to the next slide, Helen.
And you do have one more question in there, Michelle. What happens if I get the vaccine and I test positive for COVID?
Okay, yeah, so that so another good friend of mine, so he was waiting in line to get his COVID vaccine, and he got COVID actually, so he got his first dose and then felt fine, and then started having symptoms about 5 days in, and it was COVID. And so I think that's back to Dr. Schlei's point that the vaccines don't fully protect us. Certainly with Pfizer and Moderna, we don't see full protection until 42 days after that first dose. With the Johnson & Johnson vaccine, we start to see protection at 14 days. So it does seem to be a bit earlier, but we're not fully protected. And so in terms of what happens to an individual person, for my friend's experience, they still were quite sick. I personally believe that they probably would have gotten sicker had they not gotten the vaccine. I think that there probably was potentially some protection there. But it kind of depends on the timing, in terms of when you were to get the vaccine and when you were to get COVID. What we do know is that if you had full immunity or full protection from the vaccine, like with the Johnson & Johnson, if it's at 14 or 28 days after that first dose, it's highly protective against preventing you from getting really sick with COVID. And we know the same thing for the Pfizer and the Moderna. And so again, it kind of depends on the timing in terms of when you got the vaccine and when you get COVID. But I think the vaccine can only help us in recovering from COVID if we were to get COVID after the vaccine. I think there's one other question too. And then so for kids, this is a great question. So the Johnson & Johnson, their team is actually, they already have plans that they put into their FDA document that they're going to study not only children, but pregnant women. And those are for the future. I don't have any sense of when they're going to move forward with those groups. But I do know that they plan for it. The Pfizer group is already starting to enroll kids 12 to 16. And I believe that there's some plans for Moderna too. And what they're hoping to do is sort of step down each age bracket slowly as they learn more about, the immunogenicity and effectiveness in the younger age group. And so, for example, like once Pfizer has information and they've completed enrollment on the 12 to 16-year-old age group, then they might move to a lower age group. I don't think that Pfizer or Moderna is planning on studying infants less than 6 months. I think it's less clear for Johnson & Johnson if they're planning on doing that. So when that might happen, there's still some uncertainty about that. I think it's likely, in terms of moving into younger children, it probably won't happen until the summer. But that could change. So that's a great question. Some other. Related question for safety if concerns you're asymptomatic when you got the vaccine, effective, but didn't know. The vaccine is safe and effective even if you had asymptomatic COVID. Related to Pam's question, so we are hearing reports of people who had COVID and got the vaccine having more symptoms, particularly with the second dose. And I know there's been at least one preprint study that shows that folks who've had COVID who get the vaccine, at least they're sort of suggesting that maybe they'd be safe with one dose. Nobody's recommending that at this point. I think we need to get more information about that. I think that probably answers that question. And then And then in terms of, so people with HIV, so I should have pointed this out. So the Johnson & Johnson trial enrolled 1,200 people living with HIV in their trial. It's by far the largest amount of people living with HIV enrolled in any of the trials. With Pfizer and Moderna, it was about 150 or so per trial. And so they haven't explicitly said they're going to do a subgroup analysis for people living with HIV in the Johnson & Johnson trial. But they did have some preliminary information in their FDA report. And it was hard to draw conclusions, at least in terms of the efficacy, because there were no cases of COVID in anyone who had HIV, either in the placebo or in the intervention arm for the Johnson & Johnson. They didn't report out on any, I mean, globally, they didn't see any differences in side effects. My guess is they'll probably do, I mean, at least I'm hopeful they'll do a subgroup analysis for the Johnson & Johnson, but I was really, as you know, someone who cares for people with HIV, I was pretty happy to see that they had so many people living with HIV in that trial. So if the person is vaccinated and has COVID, does that decrease the effectiveness? If anything, it actually, having COVID and then getting the vaccine, you will likely have a more effective immune response or even more protection against COVID in the future if you've had it and then you actually get the vaccine. And so in terms of side effects, so I lined up the different side effects. I think it's pretty safe to say they're largely very similar. You know, for whatever reason, people had a little bit more of a sore arm, and the folks who got the Moderna vaccine versus Pfizer and Janssen, or the Johnson & Johnson. You know, the swollen lymph nodes thing is interesting. You know, I've certainly heard anecdotal reports, and my husband is one of them. He had swollen lymph nodes after he got the Pfizer vaccine. He keeps telling me that is preventing him from doing pull-ups. And I keep telling him, no, the reason you can't do pull-ups is because you're 50 and you haven't done pull-ups before, but he keeps saying that that's a side effect. But, you know, in all seriousness, the swollen lymph nodes have been noticed, and you know, there have been a number of women who've undergone mammograms, and, you know, that's led to further testing. And so it is something to be mindful of and warn, you know, potentially, you know, talk about if patients are concerned. It's not harmful. It's just a finding that was noticed. But they're pretty comparable in terms of side effects, I think, you know, where people do report fevers and body aches, a little bit of fatigue and headache. I've also heard some folks are concerned about the second shot, which, you know, does tend to have more side effects than the first shot for a lot of folks. So I've heard some concerns about folks not wanting to get the second shot because they're afraid of missing work because of side effects. And at least within our own cohort of healthcare workers here at Denver Health, only 2% of people had side effects severe enough with the second dose that they actually had to miss work. So I think that's another important messaging to kind of get across to community that, yes, you know, it's true that with the second dose for Pfizer and Moderna, you might have more side effects, but the vast majority of people were still able to go to work and function, even though they had more side effects. So we talked about vaccine every year. So in terms of vaccines being tested with people with disabilities or autism or Down syndrome, so I think that's an excellent question. What I'll do is comb through the FDA, as I do believe they talked about that. I'll look through the FDA documents for all 3 vaccines and make sure that I get back to this group with the answer to that question. So I don't have it at the top of my head. And so just as we've kind of talked about, so vaccination is really just one measure to help stop the pandemic. And as we've kind of mentioned, it's still really important for us to wear a mask when we're around other people, practice social distancing, and try to avoid poorly ventilated spaces and wash hands whenever possible. Next slide, please. Let's see, it's 3:50. We're kind of running short on time. So what this is, just very quickly, and then if we have time later, is just a summary of the different vaccine entities available through Denver County. And my team secret shopped all of these places to see what options were available in other language. And so this is just a quick summary. So maybe in the interest of time, what we can do, Helen, is just I can share this out with everybody, so you guys can go through it, and then we can walk people through a little bit later about how to coach people on how to sign up for the vaccine if there's still time. Okay. Okay. Any other questions before we turn it over to talking about vaccine hesitancy?
Looks like we have one in the chat that's going to be translated. And feel free to come off mute as well.
I do have a question. This is Fernando Pineda, Crea Results. I think your first two slides were like the ones that don't want to get too sensitive about it, but it just kind of like almost makes me make my head shake and almost makes me cry. That it's like, okay, here's again the evidence that we always seek, but we always have, and we always know that we need to aim for changing. And I think it is so important. I'm very appreciative that it's plasma, it's there in our face, and I'm thinking, okay, we knew that, or now we know it again. Now, what should we do now? And I think for us as promotores de salud, community health workers, it's like we strive to always try to get people to the yes, even if it's voluntary, use your choice and whatever. But we say, hey, we're always there like a wooden stick, right? Like, I have an agenda. I really want you to consider this for your future. So you get people to the yes, and then they say, okay, fine, you got me when you say I'm gonna miss the quinceañera, or I'm not gonna be here for my family. Okay, whatever, I'll get it. And then it's a struggle to even just to, how do we go about it? So I do wanna not just complain, I wanna offer our assistance. I'm part of the ambassadors ambassadors program. We have everything from passion to sometimes limited funding opportunities like a radio show and things like that. But more importantly, I think what I would really like to focus on a maybe later opportunity to discuss this in seriousness is to say that how do we get ready? I think we're below 60 years old right now, which is great. But when we get to 50, which is almost like open range, right? Can we be ready with like 5, 6, 7 events that we know they're coming, we know they're going to happen? I personally would like to offer that, but I have not yet create my own event because there's so many issues in the world that it's just so difficult, and a lot of great people are doing it. But we are in contact with the churches, we're in contact with the schools, we're in contact with the Denver school systems. And I would just love for us to figure out an easier way to say, even for people lead us this call, to say like, okay, who's in, we'll do one with you. And then let's just triage that, whoever wants to do 5, that's awesome. Whoever has a lot of money to do 7, perfect. But I think we should be able to, for me to be able to say, I'm not just talking, I am gonna give you the shot next week if you are ready. And I would love to strategize about it with no criticism. I know we're all doing our great, but it's always, again, it's one of the things that I'm talking a lot about this, and I'm getting pressure for like, I'm ready, where can I go? And then I spend endless hours trying to get them a shot.
Thank you so much for saying all of that. We're certainly hearing that access is a tremendous issue. I personally think there needs to be a lot more accountability and transparency with the larger healthcare organizations, and that they need to be held accountable for issues around language justice. So making sure that that their information is accessible. I'm glad to see that there's fixed community vaccination sites. I worry that it's not enough, and that we need to ensure that that the larger healthcare organizations like Denver Health, where I work, are have better reach. I do think there needs to be a way for folks to call in and directly get scheduled as opposed to a waiting list. So I mean, our team is like is like 4 people that can do that. But I think just to, again, hold larger healthcare organizations accountable for that. And then also for funding for community-based organizations. I was talking with Wella for Health, one of our partners, and they're having to do volunteer work to sign people up for the vaccine and to host these events. That's not okay, given that you guys are already doing so much work in the community anyway. And so I think whatever we can also do to ensure that there's even more funding and more support for those of you who are doing this work would also be impactful.
This is John Young from the Center for African American Health. We are also getting the same thing, but I'm also having to listen to people with compassion and not beat them with the COVID stick. Because I have some people who are feeling like, well, I don't want to do this, but I've been pressured. Oh, I don't want to do this, but everybody's making me do it. So part of what we've just done is just given the people the information and invited them to do it when they're ready and however they're ready. I still am just mystified that 10 people did not know they were supposed to come back from Zion Baptist Church. I don't know how 10 people did not know they were supposed to come back. But when we contact them, we'll just say, hey, it's good to see you. Hope you're doing well. You're in our prayers. Let's do this.
Yeah, I think that's really important. I mean, obviously I'm a big proponent of the vaccine, but I think people do need to have some agency and feel comfortable about their decision. And I think also hesitancy is tied a lot to access. I think if people, even within in my own family, my sister didn't know she wanted to get the vaccine, and or my friends, and it's like, when one person gets it, gets the vaccine in their social network, and they're able to talk about it if they are willing to share about it, I think that helps other people with their decision too.
So on the same note, is there better, I think groups like this and trainings like this, I'm extremely appreciative of, and it's also an opportunity for us to discuss. And I know we're short on time, but I think when it comes to the very same accountability of the community ambassadors and what are the from using lingo for low hanging fruits, right? To like things that we could say, hey, who's doing work in this county, and can we triage that to say that I think, again, working from nonprofits all the time, there's anything from the passion to the direct turf territory, personalities, egos, and everything that gets in the way of creative thinking and really being able to be at service the best way. So I think I'm proposing, as usual, I always believe that juntos podemos más, right? That together we can do everything. And I'm excited. That's what I want to bring about, like getting us together, talking about it. And I know we're doing our little thing here and there, but I wonder if we could continue to peel that onion, as we do have some of us this little funding, and some of us have big funding, and some of us have no funding, to say, yeah, don't bug me every Friday, where some of us are like, I need to do something by Friday. So we'd love us to keep exploring who has that lazy Susan kind of thing, right? Of saying like, jump in, I'll direct you with this person, because what we needed was some talent for a commercial, and 7 of us can do it. And what we needed was 7 people to volunteer on Saturday, and some of us can do it.
Yeah, I think that's a great point. I don't know if Judy, if you want to jump in about how folks can coordinate, at least across Denver County, and to how we can partner together in some of this work.
I'm sorry, I wasn't listening as deeply as I was supposed to. So can you just want to know how?
Yeah, I'm happy to jump in too, Judy, on this.
Oh, thank you.
Yeah, I do think that this is really related to the ambassador program in general. And Fernando, I think if we all here find a need for a space for us to collaborate and talk together about what we're each doing, we can make this a space through the Community Ambassador Program where we can all meet here. We didn't want to put that on you all if you felt like you had already too much on your plate and we're asking too much of you. We can also have our LPHA liaisons for each of the organizations here, connect with all of you and have a community of practice there as well, especially since we're trying to work this through the county lines. And so happy to make a note now for our community ambassador liaisons through LPHAs to connect offline and figure out a way for us to support you all moving forward and talking about all of the work that you're doing together, how you can get everyone to collaborate and learn from each other and know what kind of events are happening. I also think that there's a place for us to teach each other what's happening, and maybe we can figure out a way to get common updates going. For example, you know, Jeffco did a town hall yesterday and is going to continue to do that with the library on the COVID vaccine. I know that Tri-County is going to be doing that fairly soon too. And so how do we get you all the information so you know that's happening and you can promote that with your networks too? So Fernando, happy to coordinate that through our program here.
Great.
I also just want to acknowledge, so Michelle had said, you know, can we acknowledge the LGBTQ community has been left out of this conversation? And we absolutely do need to acknowledge that. You know, even with our data in terms of, you know, our data is very binary in terms of folks identifying either male or female. So there's no, I don't know that there's any data that's being collected. And so we haven't, we do need to be held more accountable. We do need to involve other communities as well. And I think to that end, the disability community has also been largely left out of a lot of these conversations as well. And so I think, you know, in terms of our community ambassador program, I think that's also something important to think about.
Great. And Michelle, did you see there's one more question about what about people who are allergic to any component of the vaccine? And then a question about moms breastfeeding.
Okay. So if folks are allergic to specific components in the vaccine and they know that and they're aware of that, then CDC is recommending that they not take that particular vaccine. However, if someone has a serious allergy that's not related to a component of the vaccine, we are still recommending that folks get vaccinated. So for example, if I am allergic to latex and I carry an EpiPen because I'm allergic to latex, I can still get the vaccine because there's no latex in any of the vaccines. And then breastfeeding. So breastfeeding women weren't included in any of the trials. We are, so the American College of Obstetrics and Gynecology has come out saying a statement that we all feel that they, even though they weren't specifically studied, there's no reason to believe they would be unsafe. And certainly if moms who are breastfeeding qualify for the vaccine for other reasons, we would recommend, you know, we would be supportive of women getting the vaccine. We also would recommend that, you know, women who are concerned and, you know, want to have their specific situation, you know, they should discuss that with their provider so that they can feel comfortable about that. And then I can just share that one of my colleagues who's breastfeeding, she went ahead and got the vaccine. And I do believe they're enrolling an observational study of women who have chosen to get the vaccine and are breastfeeding. So. Oh yeah, so Pauline, if you want to talk about.
Hello, yes, so something that I'm an IBCLC International Board Certified Lactation Consultant, and I will be happy to share it. So one of the concerns is that anything from the vaccine may go into the milk, right? So what we know from any other vaccine is that if it goes through the digestive system, the acidity of the stomach is gonna kill anything that could be transferred. So I think that when we're talking with moms and with families, that tells them, oh, that's what we're talking about. There's very, very low chance that anything will go through human milk, given the way that vaccines work in our body. If anything, it's the activation of or the immunoglobulins that activate our immune system that will go through milk and could be absorbed in the child system. So it will be even better for those babies. But if it's a concern of a component of the vaccine going through milk, then that gets totally destroyed through a digestive system. And that's why vaccines are not something that we eat, it's something that's injected. So even in I was saying the implementation of, or the functioning of vaccine, that there's very there's no reason to think there's any risk. All the opposite. When a mom's a parent, a breastfeeding and nursing chest feeding person nurses their baby, that human milk may actually have immune protection for that baby and to support as a backup for that baby immune system. And I think that when we talk about it in those terms, many families go, oh, that makes total sense. That matches what we know on how our immune system works.
Nice. Thank you for that.
You're welcome.
Great. Well, I know we have another question that'll get translated. So I think in the interest, oh, look at that. Okay, so let's address this and then we'll move on. It's important to consider the hours in which vaccines are being offered because there are many who are fighting not to be evicted, to bring food to their home and consider it essential to work. It's difficult for them to stop working one day and would be excellent to offer hours outside of work hours to get vaccinated. Yes, thank you.
Yeah, that's an excellent, excellent point, and I couldn't agree more.
Yeah, and I think too, I just wanted to say thank you all for speaking about how this ambassador group could be a community. And while we know there is a certain amount of coordination that some of you captured in the chat that will happen within your county that you're serving, we will also explore, as Nicole committed to, how to come together with this group and at least help share where some of these fixed vaccination sites are. We know that people travel in and out of county lines and work in different places. So I know Metro Denver Partnership for Health has spoken to the state health department about trying to get a more robust list. So we hear you all, and I think it will be important for us to continue to stay in touch and really share some of this knowledge. And it sounds like we have a commitment from Nicole and Metro Denver Partnership for Health to make that happen. All right, so if you all have any other questions in the chat, we're going to switch, but Michelle will be on so she can help address those if they're around the efficacy or safety of vaccines. Please go ahead and let us know. I'm going to do my best to present for my colleague, Tiffany, whose content this is, who became sick this afternoon, and I wanted to support her in taking care of herself. So we're going to just look at what we know about hesitancy and a few communication tips. So this slide is from the Colorado Vaccine Equity Task Force. It was from a large study done in November 2020 with over 12,000 American adults. And what you can see when we ask people in November, would you take the vaccine? There's a lot of variance between different communities. We have our Asian community with the largest amount of people saying they would take the vaccine. At that time, Latinx and white communities were around the same, and Black were falling behind and saying yes to the vaccine. On the right-hand side, as many of you know and likely have experienced, there's varying levels of trust about vaccine safety and effectiveness, and we see that Black communities are lower in their trust around safety and efficacy, but we also see this is lower for our Latinx community. So the concerns that we were able to talk through with Michelle are very much concerns we know that community has. And as ambassadors, you all can help discuss these concerns using a few of the techniques that we'll talk about in a moment. And I think throughout COVID-19, many people want to know what information will be collected and will my information be protected? And what we can say to people is that the vaccine is free. We're not requesting IDs or insurance cards or proof of employment. We only need your name, date of birth, phone number, and address. And this information is used for statistics for the health department and not for anything else. I will say that Governor Polis a couple of weeks ago is requesting that vaccine sites collect race and ethnicity data so that we can continue to monitor vaccine uptake across communities. So you may also want to let people know that race and ethnicity data may be collected, but they can decline or they can choose other based on their comfort level. In addition, I do want to share that we have been in this interesting place in our country where COVID has become a political issue. And so this survey was conducted in February of 2021 with over 400 Colorado registered voters. And as you can see, depending on political lines or beliefs, people felt differently about getting the vaccine. So in terms of hesitancy, it's important for us just to understand that there is trust, there's mistrust, There's concerns around efficacy and safety. There's political views, as Michelle and Fernando were talking about. There's a lot of social networks, wanting to uptake this after friends and family and communities have received the vaccine. So we know that there are many factors that impact an individual's choice about when to get the vaccine. And it's really important as we identify hesitancy that we listen to the root cause of the concern. Is it the science? Is it overwhelm? Is it access? Is it a belief system? Do we believe it's not necessary? And that we address these concerns without assumptions. And then again, using communication techniques that help empower the individual to make the right choice. So again, starting from a place of empathy and curiosity is so critical. May I ask why you're concerned about the vaccine? May I ask why you're not getting the vaccine? What have you heard? Explaining what we know and we don't know about the vaccines, and then potentially exploring questions such as, what would it take for you to get vaccinated? And then addressing any fears about side effects, which, as Michelle talked about, we know a lot of people have. So again, being able to talk through those and help individuals navigate those fears. And as I mentioned before, there's so much confusing information, there's misinformation depending on where you get your news, and how news translates some of this data. It's very complicated for our community to understand. And so it will be important to kind of identify where misinformation may come from and just help the individual access key facts or what we know. And the CDC website that's on this slide is a great resource. They have a lot of FAQs that have good health literacy in many languages. So I encourage you, if you haven't spent time to look at some of these fact sheets, and they may be helpful for you to download and print and carry with you as you do your work. One of the communication techniques that we have found really effective in our COVID-19 case investigation and contact tracing is called Ask, Tell, Ask. And so I wanted to offer this to you today. It's a collaborative communication method where you ask an open-ended question, you tell or you share current knowledge while asking permission, and then you ask what else would be helpful to support your decision. So an example, tell me what you know about the vaccine safety. And then again, telling but asking permission. Do you mind if I share more information about the vaccine safety? What we know is. And then that last ask, what else would be helpful for you to know to help with your decision? So again, the ask, tell, ask framework will help you as an ambassador really know where people's concerns are, help you share additional information that may impact their ability to make the decision, and then also help you know what additional information will help them, whether or not you can provide that or you can help them figure out where to go. Another communication technique, which I'm sure some of you are familiar, is motivational interviewing. And this is really a client-centered guided communication style for enhancing a person's own motivation for change or action. And really with something like to get or not to get the vaccine, we want to empower and believe that each individual has the authority to make their own decision. And so when we think about motivational interviewing, the real spirit of this technique is through evocation, which is learning what the individual's ideas about the vaccine is, or about getting the vaccine or not. We also want to be collaborative. So you as the ambassadors or a healthcare provider is collaborating with the individual to help ensure they have what they need. And then also really this belief that the true power to make the decision about vaccine is the individual's. Even though we may hope that the individual will act one way, we support them in making their decision. And then the principles on the right hand is expressing empathy. So really genuinely caring and accepting where individuals are with their decision about vaccine. We also want to develop discrepancy, so kind of pointing out patients' goals or values around their decision to get vaccinated. We also, as ambassadors, need to roll with resistance, right? So we won't oppose or argue with the individual, but we may offer a new perspective about why to get the vaccine or help them really weigh pros and cons of getting the vaccine in a collaborative way. And then finally, we want to support self-efficacy or self-confidence is another way to think about this. So believing that the patient or the individual is responsible for choosing if they will get vaccine or not. Our role is to really, again, offer information or resources that help support that decision. So around developing discrepancy, questions such as helping the individual identify where they currently are with their decision and maybe where they want to go in the future. So what are your goals for the future? How do you see the vaccine affecting your goals? In a story recently for me, I was talking to my neighbor who has a lot of concerns about the vaccine, is currently eligible, but wants to go see her elderly parents. And through this conversation and thinking about this trip that she wants to make to see her parents this summer, she was weighing the pros and cons and realized that her current decision about getting the vaccine would help her achieve this goal in the future of visiting her parents. So I think this may be a way that we can help people think about what their future goals are and how this decision impacts them. And then I have some examples of motivational interviewing that Tiffany provided in terms of rolling with resistance. So I'm just going to read this interaction for you on the slide. The individual saying, I think the vaccine might be unsafe. I think you doctors are pushing this too soon. Someday I may consider getting vaccinated, but not now. We could say, it sounds like it's really hard for you to believe that the vaccine is safe because it became available so soon. Exactly. Well, I can certainly understand why you would feel that way. May I share why the vaccines are available, and then you can tell me what you think? So in this example, we're hearing what the patient says about their resistance, about the vaccines were developed too fast. And we're coming alongside of the individual, we're reflecting their concern, and then we're offering a different lens to view the safety of the vaccine. Another example is reframing this non-change talk. So here the individual is saying, I think the COVID vaccine is important, but I'm really worried about the side effects. The provider could say, preventing COVID is clearly important to you. If you thought you could manage the side effects, would you be more likely to get the vaccine? So reframing, taking that negative issue around being worried about side effects and reframing it to, if you could control those side effects, would you be more likely to get the vaccine? So that's considered, just helping a reframe or a different view for the individual to consider how this may impact their decision. And then finally, this is a lovely slide for you to consider as ambassadors, a decision tree about when or when not to use motivational interviewing. So if you hear that a person will get the vaccine, there's no resistance to the recommendation, you will not need to use a technique such as motivational interviewing. However, if people fall into the no, they currently feel that they will not get the vaccine or they're not sure, they have hesitancy, then you will, as we've just talked about, explore the person's thoughts about the vaccine, reflect back any cons and pros of what's stated, and really through collaboration, engage in a conversation that will provide equal and common ground for the discussion. And then in the end, we're going to support the autonomy and the person's decision, whatever it may be, but remembering how to engage in this conversation and help them will hopefully support you all in navigating these conversations. So in summary, motivational interviewing allows people to feel heard and respected. When people don't feel pressured, they're more likely to explore openly and honestly their thoughts about the vaccine. and they may lead people to see the situation in a new way and form a whole different conclusion. So with that, I know we're close to time. I believe the calendar invite was up to 4:20. We do have some resources that we just wanted to run through. Again, that CDC website is really helpful. Please spend time there if you haven't already. The Denver City website also has a lot of vaccine information in a variety of languages, so that's a great resource. And then Michelle, did you want to spend a minute talking about accessing your team's services?
Yes, so this is for Denver County, unfortunately only. And just we'd love to see more folks, but that's just how our funding is aligned. So if a person lives in Denver County and they get COVID and they haven't had the chance to have the vaccine, if someone's diagnosed with COVID and they don't have a provider or health insurance, our team can see them at no cost to them. And so what we can offer is seeing someone in their home. It's performed by an outreach, one of our actually TB disease investigators who both have over 15 years of experience seeing people in the field and in their homes. What they'll do is do a quick medical assessment, give folks a pulse oximeter, and link folks to medical care, not only for the patient, but we also will go ahead and evaluate anyone in the home who's sick. So sometimes one visit turns into 5, and that's okay. We have that flexibility. And then we can connect folks with financial support programs. We can deliver Amazon Fresh. That's actually one of the most needed resources. We can deliver groceries for even a household as large as 16 people same day if needed. And then we also have a social worker if folks have multiple needs, that need kind of more longer term coordination. And so folks can self-refer. So I have the phone number here. So feel free to give that out to your community members. I did list our email. It's not my preference to receive personal health information by email because I can't guarantee that it's encrypted, but folks can call. If for some reason they don't get a live person, they can leave a message, request the language that they need, and then we'll get back to them right away.
Great, thanks Michelle for sharing. And then also regarding vaccine appointments too, we included the pharmacy information, which is vaccinespotter.org. So this links to all the pharmacies that are booking appointments for vaccine. It is a little hard to navigate. Some pharmacies like Walmart encourage you to have an account. So we're not sure if you as an ambassador, for example, could create an account on behalf of someone, but we wanted you to be aware of that resource. The Community Ambassador Training resource that you have in your shared Google Drive that Elizabeth and I believe Paulina may have started also has all of the major healthcare organizations across the Front Range and information about how to sign up: Kaiser, Denver Health, Centura, University Hospital. So that's linked here and also in your Google Drive. And then we also have CDPHE's website, which we know is also cumbersome and doesn't always get you exactly how to sign up. But as we talked about earlier, we'll commit to sharing with this group as much as we can about where these vaccine sites are happening. And we have asked the State Health Department to help us with a better list and understanding of some of these fixed sites. So we hope that those communication techniques have been useful. I know there was a lot of chats and we are set to end, but Michelle and I could probably stay on for another 10 or 15 minutes and answer questions. And then I finally just want to say thank you to you all as community ambassadors and the great work you're doing. Other colleagues at Denver Public Health who have really helped with some of these maps. The Colorado Vaccine Equity Task Force, and Elizabeth for some of your materials that helped shape today's presentation, and Nicole as well. So with that, I'm going to stop sharing. And then Michelle, have you been monitoring the chat? Do you have a sense of where we are with questions?
Yes, I was doing that while you were talking. I think I've gotten to most everything. If you put something in the chat and I missed your question, feel free to you can go ahead and say it now, and then I'll get to it.
I think just a comment. This is Fernando. Sorry, I didn't put it in the chat, but I think it's a comment and maybe a question there that knowing that we know on the disparities, I'm starting to see great opportunities for funding opportunities for spread the word all the way to create this. But again, sometimes it gets, as we know, very politicized. And is this an affirmative action? Are we putting priority in certain populations and there's not? But I will encourage us as very few times we have the opportunity to really keenly look at the data and to say, where are the areas, where are the partners already in place, who's already doing great work that with a little bit more could be do great work. And I think, again, as a speaker, not just for myself, on behalf of my peers, chasing the funding, chasing the connection, chasing the things sometimes is really hard. As I would love for us to continue to learn about, like, there is this organization who does great work. They only have, they maxed out around 400, but those are awesome because they're 400s out of the 29% that has been under, and I think sometimes we spend a lot of time chasing the opportunity to do what we're already doing. And I think, again, it's not about creating a little club where we all know, but it's sometimes we already know who, even here on some of our peers and partners, we sometimes are forced to compete for the opportunity to continue to do great work rather than say, there is already an infrastructure, there's a need, and it could be covered. And no, you cannot get the whole shebang because we need to spread it in 25. Or sometimes this person, this organization does require this additional opportunity, not because they're better than everybody else. It's just they are positioned that moment to address that percentage of the population that needed the service. So it's not a criticism, we're all in the same boat, but I think it's only in these forums where I continue to reiterate that sometimes we already know what's going on, we just need to strategize what's the best way to address it.
Thank you. Well said. And just so you all know, I wanted to make sure that Nicole put a resource in the chat. That's how to sign up for vaccines. That's updated real time. So I just wanted to make sure everyone saw that. Any other thoughts, questions? And then Elizabeth, I'm going to put your comment. It came to me. Oh, so I just put that in the chat to everyone. Well, it sounds like we're winding down. Thanks for sticking with us 7 minutes later. So Michelle and I will commit to getting back to you all on some questions we couldn't get answered today. And then we're happy to help create this space for you all to share information. But we really appreciate all of the work you're doing and sharing your thoughts and questions today. So Nicole, anything you want to say before we say goodbye?
No, thank you to Denver Public Health, Michelle and Helen, everyone for putting together the presentation and being open to answering these questions in real time. I know that a lot came by, so we'll make sure to save the chat, follow up with all that, follow up with all the links here to resources, and then we will commit to following up with our local organizations, our local public health organizations, to ensure that they follow up with you with community of practices and allowing space to collaborate and move forward together. We will send up the slides and the recording, and are hoping to possibly host this training in Spanish without the interpretation, just Spanish in general, and making sure to share those materials as we move forward. So we'll follow up with all that offline and get all your questions answered. So thank you everyone for joining us today, and we really appreciate your time. Thanks for joining us, and thanks for everything, everyone. See you later.
Goodbye.